Welcome to Our Life with Ben. Almost immediately after the diagnosis, we started the process of making sure that Ben had no serious health issues. The first test we had to subject him to was the renal ultrasound. Because of the high instance of abnormalities of the kidneys and the bladder, this test was a necessity. Thankfully, Ben passed with flying colors. However, the urologist who examined Ben noted that his testicles had not descended, which could lead to problems later in life. This isn't an uncommon condition, but because Ben was over a year old, it led the doctor to believe that the situation wouldn't correct itself, as it does in most cases. Normally, there would be a recommendation to perform surgery because of the higher risk of tumors or inguinal hernias for males with undescended testicles. This was not a consideration for Ben because of his multiple health problems. Instead, Ben went through a regimen of HCG injections to stimulate the glands. This didn't improve the problem, but we decided to wait a few years before doing anything further. Our next stop was Pediatric Cardiology of Virginia. An electrocardiogram was performed, and there was no evidence of any atrial or ventricular chamber enlargements, which are common abnormalities associated with trisomy 9 patients. However, as with the renal evaluation, the diagnosis came with a big but. The examination detected a well-known but uncommon abnormality, an absence of an inferior vena cava, which is compensated by normal drainage through a lower body superior vena cava. No, I'm not a doctor, but I did stay at a Holiday Inn Express last night. The doctor's fascination had more to do with the fact that it was so rare. Basically, everything works, just not in the normal fashion. He assured us that this should not have any significance with regard to heart function or any other potential organ function, such as the liver. He was so confident with the findings that he said that cardiovascular follow-up was not a necessity. If you'd like to learn more about Ben, please subscribe below to Tri-9 Mom and visit us on our Facebook page.